Hello, Alex here with Better Years. Today we are going to talk about post-concussion syndrome. I am very, very thankful and very lucky to have Daniel Gallucci, CEO of DG Squared. It's a clinic up in Toronto, Canada, focused on brain rehabilitation. He comes highly recommended and highly sought after in Toronto for anyone experiencing cognitive impairment, whether it's from birth, or something that happened throughout your life, like a concussion. He works a lot with athletes, and he has some fantastic information to share with us. He was in a bad reception area, so there are a couple areas of the tape where we lose him, and he comes back and repeats himself, and I try to make sure to repeat what I heard that you may not have heard. But if you suffer through those couple areas, those couple issues where you can't hear him, you'll get some really good information, especially at the end. We talk about his morning routine and what he does to optimize brain function. It's pretty cool, some really good information that he shares. So I'll leave it to him and enjoy. Hey Daniel, thanks a lot for joining us here. I'm glad to have you.
Thanks for having me.
I went ahead and gave you a brief introduction, just the highlights, a little bit about you and what you're up to up there in Canada. If you want to talk real briefly, I didn't mention the clinic. Will you just quickly give a description of the clinic, what you're up to at DG Squared?
Sure. First off, Alex, thanks for having me on tonight. This is exciting for sure, and a great opportunity to kind of spread the word a little bit with some of the stuff we're working on there. So we've got a concussion clinic as well as other clinic up in Toronto called DG Squared. I'm the founder of this clinic, and we deal with a lot of both brain and body types of dysfunction. My background originally from a sort of exercise phys and then evolved into the therapeutic side of things. So we kind of take a collective look at everything there. And we've got a pretty good multidisciplinary type team that's focused on collecting a lot of data and trying to implement that stuff as we go forward to help with these types of issues and injuries.
Beautiful. That is a perfect description there, and it's good to know that you guys are kind of getting into this. I mean, I'm not too familiar with what's going on here in San Diego and the U.S. specifically, but everyone kind of hears the news, and especially if you watch some of the sports channels, concussions are a big topic, and what's not discussed as much as it should be is treatment of concussions and concussion syndrome, post-concussion syndrome that we're going to talk about today. But for our viewers here, I'm just going to give kind of a textbook definition of a concussion, and then we'll kind of dig into what that means and maybe iterate on that a little bit. But according to the Mayo Clinic, concussion is an injury to the head resulting in an alteration of brain function with physical and emotional side effects. And Daniel, since you have a little bit different experience with concussions than a typical clinician or family doctor, how would you add to this definition? How would you maybe define a concussion based on your experiences?
Right. I think it's important to kind of expand on that a little bit. The Mayo definition is somewhat accurate, but a little bit limited. One of the things that could be mentioned is that while it is an injury to the brain, it can also have an effect on the body. So there could be symptoms, and there could be sort of pathologies that are represented in the body that aren't necessarily have anything to do with the way maybe feeling centrally at the sort of brain or head level, and that still has to be sort of thought of as part of concussion type pathology. The other thing that we look at as well is that concussions can occur from not only an impact to the head, but also an impact to the body that causes the translation of forces up to the head. So, if somebody had fallen, aggressively on their shoulder and their head kind of snaps back, even though the impact was to the shoulder, the translation of linear and rotational forces to the head could as well cause a concussion, even though the direct impact wasn't there. And then one of the other things that maybe needs to be mentioned especially when we look at the sort of progression of this type of dysfunction, is that it's not only physical and emotional type issues, but and we'll add cognitive as well, which is separate from emotional, and often sleep issues. So we'll kind of look at it from a physical, emotional, cognitive, and a sleep perspective as well.
Gotcha. That's a good definition. And sleep is one of the most crucial things. I mean, I've had a concussion before, and that's something that you have to monitor closely afterwards, and you guys get into that. Post-concussion, you do a lot of sleep analysis and monitorization of sleep, not just the night of, but obviously continuing into 30, 60, 90 days probably post-concussion. So
sure.
With concussions themselves, how would you describe the evolution of a concussion from impact all the way through treatment and post-treatment?
One of the things that I think is important to understand is that the sort of evolution of a concussion can be pretty different across the board. We got to realize that there's 85 or so billion neurons, and basically 85 billion little communication cells that are communicating between 1,000 and 10,000 other neurons. So the reality of it is it's not always going to present the same symptoms in each individual. Physiologically, we'll still see some of the same changes. So for example, one of the things that we see initially as soon as this has occurred is potassium. Like, these neurons are really rich in potassium, and potassium will start leaking the neurons. Calcium will start rushing into the neurons, and that causes almost like an energetic crisis in the brain. So that will lead to cell death. That will lead to errors in communication of these neurons. Lactic acid starts to accumulate. There's an increase of free radicals. Like, if you cut an apple and leave it out, you see that free radical damage. Same thing will start happening at the brain level. That means the cellular levels of magnesium start going down, and it creates this massive sort of dysfunction. And while that sort of chemical cascade can be fairly similar across the board, the timeline for it in every individual person can be a little bit different. So some people may experience symptoms right away at the point of impact. Some it may be a few hours after. Some it may be the next day or two. So it's really important, especially with children, that parents are really aware of any sort of alterations in state. Even if it's a few hours later, even if it's the next day, if they're really seeing some differences here, then that's something that needs to be looked at, and they need to kind of go through the proper channels to try and, I think we'll discuss a little bit as well, which will be to try and kind of get them into the right hands. But it's really important to understand that this is a physiologic injury that can kind of manifest itself differently across the board.
Yeah, and I've got an image here of some of the cognitive, physical, sleep, and emotional impairments caused by concussions. So we've got a good synopsis of everything that could possibly happen, and we're going to get into kind of ways to recover from that and what we can do to kind of counteract those effects as quickly as possible. But
Sure.
Following up on that, can you give the audience a perspective on the climate and quote-unquote standard operating procedures medical professionals carry out when dealing with a concussed individual today?
Right. And it's kind of, because of the ubiquity of concussions right now, and they're one of the most common things that are shown in terms of sports injury right now. So you're seeing a lot of adopters of people wanting to get into this sort of space. And while that's good, that also comes with some challenges. As far as some of the standard operating procedures that we'll often see, hopefully for the most part, and again to your listeners out there, if they haven't done so already, and many of them I'm sure have children involved in sport, or if they're at a young age and are involved in sport themselves, there's something that's called like the SCAT protocol, the Sports Concussion Assessment Tool. It's now called the SCAT-3 because there's been 3 sort of revised editions of it. That can be downloaded on your phone. That can be downloaded on your computer. That's kind of something that you can use right at the point of contact. So a kid goes down at a soccer game. You know, you can open up this app. Like, okay, what do we need to do here? What are the signs? You know, do we need to stabilize this person? Is there a medical staff on board? What are the questions that we need to ask? What do we need to do? And it kind of gives you a step-by-step process according to what you see in terms of where you need to go. So SCAT is something that's really important for people to have. What will happen is often with these concussion sort of management centers and these concussion-specific cities, they'll have people in and do called like a neuropsych evaluation. So they'll go through, hopefully clinically see a doctor or somebody that's experienced with concussions, and then often go through this neuropsych test, which is basically like a computer or paper pencil test that can be done in about 20 minutes. That'll often be used now in the world of concussions, and you know, while that has its place and can be okay, and we can go into that. It depends on where you want to go with this. But there's some okay things about these neuropsych evaluations. There's also some things that aren't so good about it. So it's something that, you know, can be used as a tool from an assessment perspective, but it can't be the only tool. And that's the problem, is that there's many institutions, even up here in Toronto, that are almost using it exclusively as a way to not only assess but treat and manage concussions. And unfortunately, it's really not the way that it should be done.
Gotcha. Okay, so we both read and kind of gone through an article that I sent you, right. And I chose this article because it was one of the most shared and one of the most read articles on post-concussion syndrome. I'm going to post a link to it below this video on Betteryears.com, but we read this and kind of did a little bit of a breakdown. We want to kind of go through some quotes from the article and discuss your interpretation of the quote, or maybe kind of give the audience a little bit better information than is provided in an article such as this, and in a lot of articles on post-concussion syndrome out there. But this article specifically has a quote, and I'll highlight it in the article as soon as I find it. But the author of the article states that there is, quote, no real treatment available for the condition, referring to concussion syndrome. In your experience, would you say this is accurate? If not, explain and elaborate on that.
Yeah, no, in the simplest way possible. Now, it's totally inaccurate. It's unfortunate that something like that would be mentioned, because there's actually tons of treatment options available out there. Not all of them work, not all of them are for everybody, but there are definitely many options that have just evolved over the last few years to be able to begin to tackle this problem. And one of the things that we really need to look at is that from a concussion perspective, it's not so much the concussion itself that needs the therapeutic intervention or the treatment options. It's once that concussion gets to 3-4 weeks, where it's now post-concussion syndrome, and that's when the implementation needs to be had. And you can do everything from, there's visual type therapies, there's vestibular type therapies, there's cognitive type therapies, there's nutritional intervention, there's blood work, there's genetic analysis. There's so many options that are out there for people right now. So to say that there's really no treatment options available is kind of leading people down the road to thinking that there's no hope if they were to suffer some of these sorts of injuries. And until we've had people, unfortunately, we deal with a very difficult patient population. My average concussion patient has been concussed for 19 months. So, we're almost at a 2-year timeline there in terms of the average suffering of these patients. And a majority of these patients can still get better and come back to perfect health and be able to resume their careers, their jobs, and, do whatever they need to do. So to say that there's no treatment options is hugely false.
Okay. She mentions and speaks on memory loss and confusion occurring after a concussion or traumatic brain injury. She states that, and the quote is, usually memory or thinking abilities will come back by itself after a period of time, which might be weeks or months, depending on the brain trauma. Can you comment on that?
Yeah, again, very generally, for the most part, 70%, even up to 80% of people that get concussed, without any interventions, they can get better. The problem is when you're speaking of post-concussion syndrome, there's that portion of the population that doesn't get better. And, regardless of the type of trauma whether it was an impact again to the head or to the body, it's not something that just sort of repairs on its own. And that becomes a whole other issue, because when you're talking about repairing, that's very different than healing. You can have a broken leg that you don't set. You can have a broken femur that you don't set. It'll repair. It'll calcify. It will do what it needs to do to repair itself. That isn't correct. That isn't healing. So you almost need to be able to distinguish the difference and say, what are we looking for here? Are we looking to actually just have this person repaired? So then we have some sort of, do we allow for certain types of habituations to certain types of dysfunction, allow them to stay that way and just call that is repaired and say that that's okay? Or do we actively look at healing these people? And we can do that regardless of sort of the timeline.
Gotcha. And you broke up a little bit towards the end, but the gist of that is, from what I gather, is essentially if you talk about concussions, healing versus repair, I mean, you can go to a clinician, you can go to a nurse, a hospital, and you'll be visited by a nurse, and they will practice just general safe principles and treatments for concussion to make sure that you do not suffer any further injury, but there is no healing, there is no kind of prescription on what to do to actually heal the brain, and that is a continual process. It's not something you can take. It's not something that you can get done probably within a short period of time after the concussion. It's something that you have to continue to do on an ongoing basis, and it's something that has to be handled probably very carefully in order to get that full healing that you spoke of.
And that has to be done on so many levels, because then we'll focus on and say, okay, well, if it's just memory and confusion, then let's go back to these computers, or let's play these memory games, or let's add this one sort of neuropeptide in there that's going to help us concentrate. But the reality of it is that we're dynamic, evolving creatures that, we can't separate our brain and our body. So we know that there are areas of our brain that are connected intimately to other areas of our body. And so you need an approach that's going to work and heal all those sorts of things and take that into perspective and not become so reductionist just and short-sighted in terms of what we're looking towards.
Great. That's awesome information. That's good. So the author goes on to say, and I quote, with post-concussion syndrome, you can expect full cognitive abilities to return within a month, usually. So then you can begin enjoying the sport you love again. Is this true?
Yeah, no, it's funny that's said, because just like we had mentioned previously, with not being able to separate the brain and the body, this Cartesian duality that sort of has existed 500 years ago, it's still in place now. We think that, because we pass a simple cognitive exam, that means we're able to play. But the reality of it is, we can't separate that from stuff that's going on in the body. If the gait cycle is off, or the person can't stabilize their hips because their brain isn't controlling their hips correctly, or they've got a frozen shoulder on one side because of damage to an area of the cerebellum, or they don't have rapid alternating movement in their fingers the way that they should, you'd never put that person back into a sport environment, regardless of if they've got perfect on a cognitive score. So Again, it comes down to just trying to move away from this reductionist model and trying to understand that we've got to take a lot more sort of systems biological approach to looking at sort of the whole to, to restore this function.
Gotcha. Okay, perfect. And you kind of touched on this a little bit, but the author makes a statement regarding to the treatment of post-concussion syndrome, and off on just a side note, this author is not a clinician. This author is not an expert in concussion therapy. It's a staff writer for the Gazette. So I just want to make sure the audience knows that a lot of the information they get on post-concussion syndrome and concussions in general is not given to them by anyone with specific experience or expertise in this matter. It's usually a staff writer going to Wikipedia, pulling this information off from various sources and putting it together. And this author makes a statement that says, she quotes, she wants to make sure to reassure the athlete that their abilities will come back completely with time. And will you please kind of give your post-concussion syndrome treatment kind of general overview plan that would be a better way to kind of lead people after they read an article like this?
The first thing is to kind of just discard the article. It's just like a piece of, internet literature that probably shouldn't even be out there, because the most important thing is that's going to first off tell the patient that it doesn't manage their expectations correctly. The biggest thing you need to do as a clinician is to be able to come in there and say, okay, what are we going to do to manage these clinical expectations for the patient, their family, their team, regardless of whether it's a professional athlete or a 12-year-old child. So to back that up, then what we need to do is again, just inform these patients first and foremost. What is a concussion? If they're suffering from post-concussion syndrome because they've been in this state for 19 months, why? What are some of the things that are occurring with this? Just to be able to educate them and empower them. From that perspective, then we actually want to take and put the responsibility first and foremost back on the patient and back with their caregivers, back with their team, back with their friends and families. Because the worst thing that happens with these people, and what was commonly held, the most commonly held belief, even still today with concussion care, especially when they got to this point in time, when they're suffering from post-concussion syndrome, is that there's nothing you can do. You sit in a dark room, you just wait, you hope it gets better, you pray every day that someday you're going to wake up and you're going to feel better. And again, you're so disempowered as an individual that you can't really see that you will be able to recover. And from here, we change it and we flip it back on the patient, and we'll say, no matter, regardless of the type of dysfunction that they're in right now, that we're going to put this back on you. So we're going to look and say, at the end of the day, we make it so simple at the beginning, and we tell them, and just like for all the people out there, the brain, like these neurons in the brain, they need three things. You need glucose, you need activation, and you need oxygen. If we can provide your neurons with those three things, you're going to be okay. And for some reason or another, that hasn't been happening over this period of time that you've been injured. So what we will do is we will collect as much information as we can. We will try and figure out exactly what we can do to be able to provide those three things to you, and then you will learn to be able to do that yourself. And once that gets done through a variety, and we have hundreds, thousands of ways that can be done, but by being able to simplify it in that way and say, these are the three things here, this is what we're going to work towards, and we're starting today, just that sense of empowerment back on the patient is helpful. And then we can kind of work forward from there with the individual strategies, and they're different. We could talk for hours on it in terms of the individual strategies, but that's really the jumping off point there.
Okay, so for people that are not in range or able to access the clinic and some of the stuff that you guys do in-house, Do you have specific types of treatments and programs that you do virtually for people that aren't in your area?
Uh, you know, I have done that. It's worked okay. It hasn't worked as well as it has in clinic, because there's just some things there. Again, with that sort of brain body sort of connection that we can't see there, like by being able to actually put your hands on that patient and feel how certain things are going. So we haven't been able to do that. So we haven't been able to be as successful, to be honest with you, as successful from a virtual perspective. But what we can still do is we can still do, thanks to a lot of the modern technologies that we have right now, we can still do some gait analysis. We can still watch and see how the patient's eyes are moving. We can still get an indication of how their vestibular, their balance system's functioning. And that can at least sort of put people in the right direction. And you know, for your listeners out there, that's one of the main things that you need to do is say, okay, forget, you know, kind of the ubiquity of the mainstream sort of things that we'll see right now, which is like in Toronto. In Toronto, there's literally over 100 concussion providers that weren't in existence 2 years ago that are just now all of a sudden here. The reality of it is these people aren't working with patients on a daily basis. These people aren't involved with research. So then you really got to do your due diligence to find out who's actually really involved in the game here. And that usually can be hugely helpful.
Yeah, you were breaking up there at the end, but I was just saying an interesting kind of fact. I mean, this deals with all medicine, but as you mentioned, I mean, the biggest thing that people can do when researching and finding a practitioner or a clinic, or you know, even a program online, or whatever they can do, whatever they can afford to do, is to make sure that the person or the source of that information is someone that's directly involved in the research of post-concussion syndrome specifically, not a clinician that maybe has a medical degree, but what they learned about concussions was from a semester in med school 15 years ago, and now they're entering the industry because of simple supply and demand. They're getting requests, or they see maybe an opportunity, and now they're entering the industry, but in reality they are not up to date on the research of today and the treatment options and the treatment pathways that you and others in your field are actively pursuing and refining today. I think that's a really good point and piece of advice to give.
Yeah, you're exactly right. You know, the reality of it is not only do they spend that little couple hours in medical school, even less than that is now. And I know it works in the U.S. the same way it is up in here, because there's some of the same groups. You can go into I've been in a couple of these programs here going on 6-7 years, and I'll fully admit that I do not know the first thing about the brain. So, you know, we're only at the really beginning of understanding what's going on here. So to think that you could become a concussion provider after a certified, quote unquote, certified concussion provider after a 2-day course, you know, it's asinine. You know, so if you're going to go somewhere and you're going to see that they want basically just the neuropsych approach, then I wouldn't even bother. Like, just leave it alone, because in itself, you know, that they're only going to consider one top little new layer of the brain and forget everything else. Just run from people that are going to implement that type of strategy, because it's just going to be, not only is it going to be, people will be, yeah, but it's better than nothing. But no, it's not, because you're giving them a false sense. And I see it every day. You give them a false sense of security. You're leaving people vulnerable. If you look at some of the most recent imaging out there, you know, I've colleagues at the University of Toronto up here that are doing this new high-resolution functional MRI, and you're seeing people that are coming out with perfect neurocog scores that are still showing, now due to this improvement in imaging with functional MRI, with issues in terms of the way that blood flow is being processed in certain areas of the brain, or other types of imaging called diffuse tensor imaging, showing that structurally, you know, this little DTI, which can measure like the amazing little architecture at a small neuron level, that there's so much disruption that's still occurring. an approach to be so reductionist and close-minded.
Yeah, yeah, that's a good point, and I'll post some of the links to some of the imaging and therapies and everything that you mentioned, that you gloss over, but it's definitely stuff that if you are experiencing a concussion or post-concussion side effect syndrome that you see here, showing a little chart of some of the side effects here of a concussion. Definitely do the research, find someone in your area that has the expertise, that's involved in the research and can provide a solid pathway to healing, because it's a serious issue. It's not just a minor bump in the head. This is a very, very serious issue that could have very, very long-term side effects, and it's something you have to act on immediately.
Definitely. That's why I like the clinicians that came from that same functional neurology program, and there's dozens, if not hundreds of them throughout the U.S. now, from the Carrick Institute of Graduate Studies. At least there, they're going through a 3-year post-grad program in neurology. After that, many of them have done a fellowship in traumatic brain injury and vestibular rehabilitation, which is another 1.5 years, almost 2 years. So when you look for people like that, these are people that will often also be involved in research for the most part, and I'm not saying that's the only people you can go to, but it's a good resource to look towards, because these people are involved with it on a daily basis, and they're looking at from a foundational level all the way up. They're not just looking at one small little aspect of it here, which is a huge way to generate income with a lot of people in a very simple strategy. It's like, forget that. Like, let's look at the patient and figure it out from there.
Yes, sir. Okay, great. So, and that's another thing. I want to make sure to get that link, if I could, to that program, so that people can kind of match that if they see a profile with that program.
I can send you off all those links and stuff for those things that we've talked about.
That would be great, and I'm sure everyone would appreciate that. And lastly, this is more whimsical type information about you personally. I definitely like to share and like to hear what some of the brain health experts do during the day, during the week. Okay. Anything just that you specifically do to make sure your neurons are firing and you have the most active brain throughout the day, throughout the week that you possibly can. Anything specific you'd like to share with the morning routine or otherwise?
Sure, morning routine. Well, my morning routine's changed a little bit now thanks to my 5-week-old son today.
Congratulations.
So that's the most, thank you. It's the most amazing thing in the world. But kind of the same thing. I've changed it a little bit, but it hasn't kind of fluctuated that much. It's funny. I'll kind of put him on my little baby Bjorn strap and kind of go out for a walk first thing in the morning. I'll usually have a bit of water first thing in the morning, put a bit of sea salt in it. I've got a bit low blood pressure, so I'll do that. Kind of get out for a nice walk or a nice workout. Then I'll get back. I'll usually grab, make a coffee here at home. I put a little coconut oil in it for some good MCT type fats that are great for the brain and great for the body. I'll put a little cinnamon in it to help balance out blood sugar. Because I know when I get to clinic, I may go hours without, which isn't great, but I'll go hours probably without getting the chance to eat or things along those lines. So I'll do that. I'll usually then, have myself a good breakfast of some eggs with like avocado that I'll put some lemon and some good sea salt in. I'll sprinkle a little turmeric all over it because of the BNF. I'll do that first thing in the morning, and if everything else goes to hell, I'll still feel pretty good and be charged up for a good amount of the day for sure.
That's funny. You're the first person that's mentioned bulletproof coffee in the morning. The recipe there. That's interesting, and I'll post a recipe for anyone interested. But essentially, the idea is the fats, the medium, you said MCT oil, but the medium chain triglycerides and butter. Some people, obviously some nice grass-fed butter. they'll sustain your brain, give your brain the good fats and the energy that it needs. And
it does, yeah.
Yeah, and it actually gives you a nice full feeling. So you do, and I've also heard, I don't know if this is true, but it kind of sustains the release of the caffeine in your blood. So it kind of carries that through, instead of giving you the immediate jolt. It gives you a nice sustained caffeine, and then makes you feel full and gives you some energy. So that's a great thing. If you're not a breakfast eater, you've got to get some sort of healthy fats in your brain and keep them there as long as possible. A starving brain means obviously poor cognitive function, but areas of your brain can actually die. White matter can become inactive. And you mentioned activation and oxygenation too. The addition of sea salt to your water can help obviously carry oxygen molecules throughout the brain, help with balancing of the electrolytes, keep that water in your body, and going on a walk, activating your brain. I mean, this has just been proven over and over again. Your brain really becomes activated when you begin being more active. So going on a walk, doing something, exert some energy in the morning will help basically unload blood onto your brain and activate as much of it as you possibly can before you start trying to use it.
It's huge, and we even see it when it comes back to concussion. The most amazing thing, and we're starting to see some of the research now. There's even a journal that came out earlier this year showing and it examined the association between concussion and then lower body injuries, musculoskeletal injuries in athletes. So even from the flip side, where we've had a disruption in the brain that's then led to injuries elsewhere in the body, sort of later on down the road. And we see that in old retired NFL players, and we even see that in collegiate and high school athletes. So it's so important to understand that brain and the body is intimately interconnected. Like you're not a sea squirt that just attaches yourself to a rock and then digests its own brain and doesn't need to move. Like, we are designed to move, whether it's like a neurotransmitter or gait, a squat, so we need to be able to have that sort of activity in our lifestyle. And of course, within moderation, we've got to see exactly where people are, especially when they're coming in with these sorts of conditions. But we have to have them moving in some way.
Got it. Well, that's great information. Glad you touched on all of that. The glucose activation, oxygenation. That's the first time I've heard those three rattled off that way. That's perfect.
Yeah.
That's just
simple neuron theory. It's like the basics of
very
simple.
Simple.
Get those things to go.
Yeah, and that's the tidbits. So anyways, Daniel, I'll make sure to get some contact information for these people, but how best to reach you? Phone, email, Twitter, what would you recommend?
I would say, email Daniel at dgalucci.com would be great. Also have Twitter at DG2Corp. Is there as well. You can always reach me through there, which thankfully enough, that's how you got a hold of me, so that was cool.
Yes, sir.
I look forward to if anybody has any questions or things like that. I've got tons of information. My assistant is always sending out things to patients or just people, just from an educational sort of standpoint. Because like I said, if we can kind of lead people in the right direction, and same thing with this new charitable foundation, this Empower Foundation, that's really what we're looking to do. Is we're trying to also put people in touch with the right information, and that in itself will be hugely sort of restorative and healing for people. So that's what we're kind of working towards.
Beautiful. All right, Daniel, I'll make sure to post all the contact information, as many points that we can gather. I know we broke up a few times during that conversation, so I'll make sure to post the text of our conversation below the video so that you can actually read our conversation. And then if you want to send me those links, I'll post those too, and we will have some great information for anybody who ventures over and watches this. So
thank you. I'm looking forward to it.